of Salutogenesis and Complementary Medicine and Professor of Yoga Therapy at Sri Balaji Vidyapeeth, Pondicherry. He is the chairman of Ananda Ashram and he has served as member of numerous expert committees of the Ministry of Ayush, including its steering committee of the Yoga Certification Board, National Board for Promotion of Yoga and Naturopathy, Scientific Advisory Committee and Standing Finance Committees of CCRYN, expert committees for celebration of International Yoga Day and the Yoga and Diabetes Program. He is consultant resource person for the WHO Collaborative Center in Traditional Medicine at NDNIY, New Delhi. He is also the Joint Secretary of Indian Yoga Association and Vice President of the National Yogasana Sport Association. He is a gold medalist in medical studies and is a postgraduate diploma in family health as well as in yoga and advanced diploma in yoga. A fellow of the Indian Academy of Yoga, he has authored 19 DVDs and 35 books and 36 compilations of yoga, as well as published more than 400 compilations and abstracts on yoga and yoga research in national and international journals. His literary works have more than 3,870 citations and has a high H index of 28 and an I-10 index of 76. He is a recognized PhD guide for yoga therapy and the first Indian to be recognized as IAYT certified yoga therapist by the International Association of Yoga Therapists of USA. He was awarded Puduvai Kalaimamani by Government of Pondicherry for the year 2016. He is an honorary advisor to International Association of Yoga Therapists, Australian Association of Yoga Therapy, and Geetanjali Yoga Association worldwide. So much privilege to invite you to deliver this lecture, sir.
Thank you so much for having me here. I hope you can hear me. If not, the audio is not maybe. So, first of all, it's a pleasure to come here to your institution. And this is the first time I'm actually giving a talk at this institution. So I thank respected director, respected MS, our HOD of Physiology ma'am, everybody for this opportunity to come here and talk about two things that I love a lot. One is yoga and one is physiology. Now I'm not a physiologist, but I spent 2 decades in the Department of Physiology. So when you spend 2 decades someplace, you sort of start to feel at home in the Department of Physiology. I was blessed to, right after my medical training, join Professor Madan Mohanji at IGMC as a senior research fellow in a yoga research project that kept on going on and on and on and on and on. And then we got an advanced center for yoga therapy education and research through the Ministry of Ayush, where I was the program coordinator till the year 2013. And for the last now 12 years, I've been working at Sri Balaji Vidyapeeth, where now I direct the Institute of Salutogenesis and Complementary Medicine, where we have a school of yoga therapy and a school of music therapy. And about 160,000 patients are benefited from yoga and music therapy services integrated with the modern medical system. So today, I am going to focus on cardiovascular health and yoga therapy. And we are going to look at salutogenesis in yoga therapy. We are going to look at recent studies, yoga's role, yogic practices, the psycho-neuro-immuno-endocrinological perspective, and a few conclusions. But I always like to start with this slide. More than 2,000 years ago, Plato and the Greeks, the Romans, and the ancient Indians were not too far apart in the way they approached life. So in their approach to life, I'm just trying to find which is the best place to get the thing without blocking your view. Someplace here? Yeah. Just so that I don't have the And Plato talks about this. He says the treatment of the part shouldn't be attempted without treating the entirety. Treatment of the body without treating the mind and soul is a useless waste of time. 2000 years ago. Same thing our Siddhas have also said, our yogis have also said. And my own professor of medicine, Professor Svedhavan sir, he is the one who gave us salatogenesis, and he has talked about healing rather than curing. What is it to heal? To heal is to become wholesome once again. And Svedhavan sir, who continues to be a very dear mentor of mine, has given us this gift of salatogenesis. So salatogenesis focuses attention on the study of origin of health and well-being rather than disease. And according to Antonowski, who proposed this in the 1970s, whenever we have stress, and today your administrative officer gave a beautiful definition of stress as emotionality and manam. Tamil manam sonna, there is no equivalent word in English actually for that. We try to say it is mind, but it's something more. It is not my mind is going up and down, it is something else going up and down. Here the tension that comes in because of the stress, the same stress can either make you healthy or it can kill you. So the stress itself is not bad, it is how you respond to the stress, which is why we have a scale called Perceived Stress Scale, PSS. And every yoga study that has used PSS has shown that yoga will reduce PSS, as simple as that. Your perception of stress changes. The moment you change your perception of stress, it doesn't stress you anymore. And this is why I make a commonly quoted statement: nothing can stress you unless you let it stress you. I'm going to repeat that. Maybe you turn when again. And I'm standing right in front of it. Nothing can stress you unless you let it stress you. Because once you let yourself get stressed, your whole stress response is going to kick in. First of all, I don't like to call it stress response. Mother Mohan said, I used to argue every day about it. I said it's a stress reaction, it's not a response. Because you have no control over it. If you have no control over it, it is a reaction, it is not a response. Response means you have cognitive control over the choice. But he says, Ananda, that is what it is called. Don't try to argue about it. Call it a stress response and go on. So I respect sir, and so I came to it. It is a reaction. But if that same stressor you say, oh my God, what's going to happen, what's going to happen, what's going to happen, is going to kill you. And that is the distance in the choice. What is the distance between the stimulus and your response? There is a gap. Between stimulus and response, there is a gap. In that gap, you have the power of choice. And the power of choice is the superpower of being human. As a human being, we have that choice. And so Antonowski gave us this term, salatogenesis. Salas means health. In Greek, Genesis is the source. In Tamil, Pada Jananam Sulu, Janani. So, Jananam is Genesis. Salus is nothing but Swast. So, it is the state of feeling at ease with yourself. And how he has defined it is there is a sense of coherence which is the heart of salatogenesis. And sense of coherence has three components. The first component is comprehensibility. I can understand my life, I understand my role in life. That is the first. Second, I can manage my life. It is a coping skill. And the third one is motivational. My world has meaning. So I can understand my world, I can manage my world has meaning. If these three components are there, sense of coherence is there, and you are going to be healthy. But most people, what do they say? Sir, enna nadakkuradhu theriyala sir. Enna pandradhu theriyala sir. Eppadi adha samalikkiradhu theriyala sir. Idla enna sir projanam? Young people come to me, our medical students, dental students, and mental students. All the students who come, it rhymes, that's why I keep saying that. no thing. The student comes and tells me, a young student who's in third year, comes and tells me, sir, what is the use of being alive, sir? What is the purpose in life, sir? Why should I study? What is the use, sir? At that young age, they have that feeling, despair. That is where people become incoherent. And now all our patients in the hospital have a sense of incoherence. Sir, enna pannadhu theriyala sir. Eppadi manage pannadhu theriyala, samalika mudiyala sir. All of this is a loss of coherence. We want to move from that. What is the loss of coherence? It is distress. What is coherence? Eustress. And every physiologist worth his salt will know there's a big difference between distress and eustress. Eustress is that which enables you to become the best version of yourself. Distress is that which makes sure you are not there anymore. That is the difference. And we have the power of choice whether it's going to be eustress or distress. The same thing that can kill you can make you stronger based on how you perceive it. And that is where yoga comes in. Yoga tries to change the way you perceive life. When you change the way you perceive life, you change the way your body responds to all the stressors. It is nothing but psycho-neuro-immuno-endocrinology. When you change what happens up here. And this is why pathogenesis looks at disease and tries to help you survive. Cellulogenesis says, how can you make life more worth living? So moving from survival mode, which is your brainstem, to prefrontal cortex, which is thriving mode. So I say the shift is survival mode to thriving mode. From automatic behavior of brainstem and spinal cord to prefrontal cortex, which is choice-based behavior. All choice-based behavior is prefrontal cortex. And that is what we do in pranayama. We are shifting from normal automatic respiration to choice-based respiration. This is the basic mechanism by how pranayama changes everything. You have changed from survival mode to thriving, nourishing and living mode. And this is why the treatment paradigm where we are focused today is only looking at signs, symptom and disability. But wellness paradigm doesn't neglect that treatment paradigm. Salutogenesis does not neglect pathogenesis, but it is beyond pathogenesis. So you are looking at treatment, but you are also creating awareness, education and growth into high level of wellness. So again the same thing as given by Antonovsky, the stressor gives a tension in your system. That tension can either go H positive salutogenesis pathway or H negative the pathogenesis breakdown pathway. Who makes the decision? We make our own decision. If you say life has given me a challenge so that I can be a better version of myself, salutogenesis. I hate life, I hate God, I hate my parents, I hate my wife, I hate my kids, I hate my work, I hate my boss, I hate my students. Some recent studies that we have been doing, this is from Uttarvelu, who recently did his PhD in physiology, where we worked on HRV in hypertension. Again, yoga had amazing effect. Another work which we did was pranayama and oxygen saturation, because in COVID, we were all worried about low oxygen saturation levels. So many of the patients were saying, sir, I'm not discharged, I've come home, I cannot walk from one room to another without becoming breathless. I have to sit down 3 times before I go from my bedroom to the bathroom. What can I do? Pranayama, you use the sound. And immediately what happens? Your heart rate comes down, the tissue perfusion is enhanced, oxygen saturation level goes up, and you are able to manage life better. Again we saw this. So we did a study, it was published in the D.Y. Patil journal. Another one, again same pranayama in fetal and maternal cardiovascular parameters, which now we are taking on to the next level also. Another, because we have music therapy and yoga therapy on psychophysiological parameters in patients for angiography. People were going into angiography, they have anxiety. Can you reduce the anxiety and enhance the way people come out the other side? We have done work with root canal treatment. I think most of us have had at least one root canal. I had one yesterday. While you go for root canal, the pain, the anxiety, your BP and heart rate will go high. Yesterday I was checking my heart rate, it was 65 while my root canal was going on. Because I was doing that same pranayama we had done in our study. Before you have your, extraction of your impacted molars, can you do pranayama and reduce the anxiety? Can you do it before spinal surgery? Some of the work that is going on. Episiotomy, can you reduce the pain of episiotomy by music therapy? Music being played in the labor room. This is all happening in Pondicherry. The world knows about it, Pondicherry doesn't know about it yet. Cardiovascular response after a single yoga session. We have done with about 6,000 patients this study. Where before you do the yoga, you take the heart rate BP. After the yoga session, you take heart rate BP. And overall, always your heart rate BP is going to be significantly lower in most patients. If they are a cardiac patient, it's going to be more lower than if they are a back pain patient. Depending on the system that is involved, the significance changes, the p-value changes, but overall, even one session can benefit somebody. That is what we are finding again and again. Again, 8-week cardiovascular program. This was when I was still at A Center in Chipma. We did it in hypertensives. Again, can you reduce the heart rate? Can you change the heart rate variability? Increase heart rate variability and decrease perceived stress. One of the PhD studies by Vasantan, who is now AP at our college there. Another work which was done here, this was still at Chipma Punita's study with Madan Mohan sir and all. Again, we looked at these same studies. All of these studies, I have been working with HRV, and that is why Dr. Amudaraj and I like each other so much is when he was at Chipma, we kept on working in HRV work. Because that was our field, right from beginning with Dr. Prakash. The moment that polygraph machine, huge machine was there in Chipma, Madan Mohan sir had got it. Then we got BioPack, then we got BioHarness, and we kept on getting, we now have a small BioPack at our institute, and we are doing studies with whatever. Patient comes in with anything, you do any study, you do any yoga technique, we do an HRV and putting data together. And I will tell you again and again, what do we find? 99 times out of 100, the yoga practice will enhance the parasympathetic part, reduce the sympathetic. 99 times out of 100. But then there are practices we have shown. Right nostril breathing, you will have more sympathetic. Left nostril breathing, more parasympathetic. There is a difference there also. Again, we have looked at that. So it's not that all yoga is parasympatho-dominant. Again, Madan Mohan sir used to remind me, he said, people say yoga makes parasympathetic dominant. We don't want dominance, we want balance. Sympatho-vagal balance is the goal of yoga. Because Bhagavad Gita, it's a yoga shastra. It says, Samatvam yoga uchate. Yoga is a state of equanimity. So I say physiologically, homeostatic, balance is also yoga. At the psychological level, equipoise, equanimity is yoga. And sympatho-vagal balance is yoga. It is not you want more sympathetic or more parasympathetic. Because we all know, if only parasympathetic were working, what would happen? It would worsen in asthmatic patient. Right? Because all your airways would constrict. What would happen to your digestive system? Every yogi should have a peptic ulcer. If it were parasympathetic dominant. And I don't want to talk about what will happen with sexual organs when parasympathetic dominance occurs. That is not what happens. Sympatho-vagal balance. But again and again, and this is why another study that is immensely quoted of mine is this Chandra Nadi. If you have a cardiovascular problem, if you have stress and you want to reduce it in 5 minutes, block the right nostril with your thumb, start to breathe in through your left nostril in and out. Within 5 minutes, your blood pressure, heart rate will come down. Parasympathetic tone will be enhanced within 5 minutes. Now the same thing we did one study in Chipma was there because everybody says parasympathetic dominant, parasympathetic dominant. So we did a study with people who had hypertension, 13 of our Chipma staff. We gave them 6 weeks of yoga training, relaxation yoga training in the evenings. And we did a study. Vijay Lakshmi Madam, late Vijay Lakshmi Madam was the chief investigator for that study. And what we did is we found naturally heart rate, blood pressure all went down. After first week it went up because they were doing yoga for the first time, it goes up. Second week onwards it started to come down significantly. But we also did a very important autonomic test, which is your response to hand grip. It is a measure of sympathetic tone. How does your blood pressure change when you do isometric hand grip? So when you do isometric hand grip, it goes up because of your sympathetic tone. You know what we found? That the hypertensive patient, the initial finding, sympathetic tone was lower than normal. Why? Because of autonomic dysfunction. As I was saying in the surgery, why do people have a cardiac arrest and you lose the patient on the table? Because the sympathetic tone is not good enough to manage the stress and they go into collapse. Collapse is one of the responses to stress. We only think of fight, fright and fear. We forget there is something which is paralysis. And that is why today they are talking of polyvagal considerations, the ventral vagus and the dorsovagal response, where you go into paralysis like small animals. When they are faced with a danger, they just go and like our students in Viva. Suddenly, what is your name? They go into that. It is a total paralysis. So what we have found, left nostril. Now with those patients of hypertension whose sympathetic tone was lower than normal, at the end of that 6 weeks, their sympathetic tone has enhanced. So when they were doing hand grip, the diastolic blood pressure was now coming up to the normal level, whereas it was subnormal when they started. So it is not only parasympathetic. If sympathetic is not working, the yoga practice will also bring the sympathetic into the normal level. This is what I want to point out here because there's too much of this. People's parasympathetic is in the basement. Sympathetic is on the 7th floor. So naturally all your studies are going to look like the sympathetic is coming down, parasympathetic is going up. But actually what is happening? It is only balancing. And that is why sympathovagal balance is the only way to understand actual yoga practices. Again, we looked at alternate nostril. Right nostril, definitely sympathomimetic. So if a patient comes and they are having a breathing disorder, start off with right nostril breathing to open up the airway passages. This is how the therapy at bedside is. We talk about from the lab to the bedside. And this is how the application of research is taken. And then what you find at the bedside, you bring back to the lab. We have been doing this immensely over the last 16 years. So I would like to talk about some mechanisms because not always I get an audience like this who understand physiology. Okay? So I want to talk about this because you will really enjoy this. Healing looks at lifestyle, attitude, relaxation and breathing. And in yoga we talk about achar, healthy physical activity, vichar, healthy thoughts, ahar, healthy diet, vihar, healthy relaxation, and most important is the last one, vyavahar, healthy relationships. Because if your relationships are not healthy, you cannot be healthy. All of this is part of the yoga approach. And relaxation is the key. So, if you cannot heal, why cannot you heal? Because you are stressed. I want to get better, I want to get better, I want to get better, you will never get better. It's not possible because what will happen? All your blood vessels have gone into this state. What will happen to tissue perfusion? It will go down. Unless you enhance tissue perfusion, you cannot heal. Because if tissue perfusion is not enhanced, the healing metabolites cannot reach the tissue that needs to be repaired. And this is why educing the relaxation response is the most important aspect of yoga and healthcare. And it is a non-pharmacological, self-induced methodology. You can empower the patient to do it. You can teach them to relax whenever they are stressed. Whenever they are having illness, you can teach them to relax so that the healing mechanism, what we say, stress response is inversely proportional to relaxation response. But relaxation response is directly proportional to healing response. So the more you reduce the relaxation response, the more the healing response. If there is stress response, the healing response is going to go down. Directly proportional, inversely proportional. And without a single drug, because we know every drug we give comes with a side effect. We know that. But with yoga, every practice you do in yoga comes with a side benefit. You do it for hypertension, your diabetes improves. You do it for diabetes, your sleeping disorder goes down. There is an added benefit with yoga. That is the difference. And when you add yoga and modern medicine, synergistic benefit to the end user. This is why we want the rest and digest, rehabilitate and heal. That is what we want to educe. And this is why we want to shift from a sympathetic dominant, which is retarding rehabilitation and delaying healing. We want to shift to parasympathetic relaxation response to help the rehabilitation and manifest healing from within. So the goal here is do less, help more. Because what we tend to do is flog the tired horse. It happens in all institutions, it happens in all families, it happens in our body also. That part which is doing its job will be given more job. My father used to say, the reward for a job well done is more work. That is actually what happens, and same thing here. So I want to give you an idea here. We know about sinus arrhythmia. To keep it simple, you breathe in, sympathetic activity raises heart rate. You breathe out, parasympathetic activity or withdrawal of sympathetic activity, and heart rate goes down. I am keeping it very simple. Now what do we do in pranayama? Slow, deep, extended exhalation. The typical pranayama ratio is 1:2. So what are we doing? Breathing in, and then we are breathing out for a longer time. When you are breathing out for a longer time, which part of the autonomic limb? Parasympathetic is being pulled in. The vagal tone is being brought into your mindful, conscious control. Normally we say autonomic is not under our control, but through pranayama, you are actually starting to bring the vagal tone. You are enhancing vagal tone by prolonging exhalation. This is a very key element. So now you say, sir, how can I prolong exhalation? We say, okay, let's breathe in. Now breathe out for 8 count. Okay. Let us breathe in for 6 count. Let's breathe out for 12. Sir, mudila sir. After 4 or 5, they say I cannot do. So what do? You add sound. Because when are we making sound? On the exhalation. How do you prolong exhalation? By adding sound to it. And so we call it Nada Pranayama. So instead of just saying breathe out, I say breathe in. I've elongated my exhalation. Or I can breathe in. Or breathe in. The makara is very, very useful because it is humming. Humming enhances endogenous nitric oxide also. So you are getting the benefit of exhalation being extended plus sound which is enhancing endogenous nitric oxide. You can see the benefit that is coming to the whole vascular system. And tissue perfusion is going to be enhanced. Which means healing is going to be enhanced, which means the patient can get out of the hospital earlier, which is what we nowadays want. Same thing, we have our baroreceptor mechanism, and we all know what is happening. All the blood is having to go up. Imagine every day you have to keep on pushing up. You have to lift. After some time, you let go. The heart gets tired and it says enough of trying to manage you. Because we are always having the head above the heart. So what do we do in yoga? Head below the heart. The moment I bring my head below the heart, suddenly what is happening? The blood from your aorta can move through those coronary arteries in in a very dynamic way, and suddenly the baroreceptor, instead of, see, always the baroreceptor is saying not enough, not enough, not enough, do more, do more, do more. This is the normal issue of baroreceptor. Suddenly what has happened? It is saying, Yaba, adhikma, slow down. Imagine the woman in the kitchen making this dosa and giving to the whole family. Guduma, 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 guduma. Upama mana, dosada, guduma, guduma. Now suddenly what has happened? She has two people helping her. Unna venuma, illa konja wait pannuma. You have changed the whole mechanism. Head below the heart. Now, when I say head below the heart, people think of Shirsasana. No, no, no. Simple thing. This is also head below the heart. This is why the Japanese are so healthy. When they meet each other, they go like this. Once upon a time in India, நம்ம நாட்டில் பெரியவங்களை பார்த்தா சாஷ்டாங்கமாக பண்ணுவோம். அடுத்தது என்ன ஆச்சு? இந்த காலை தொட்டு கும்பிடுவோம். அடுத்தது முட்டி, அடுத்தது இடுப்பு, அடுத்தது வணக்க சார் சொல்லி தலையில கை வைப்பான். இந்த பஸ்மா சிவன் தலையில கை வச்ச மாதிரி. We are moving towards that. It was not, we are saying, oh, why should I bend to you? No, why are you bending to other people? This type of movement, your heart is coming above the head. You are changing the way the blood is flowing across. This is the mechanism, we know this. What is happening is that always this baroreceptor is firing because it is having to say, I need more. Now suddenly it is saying, I need less. Slow down. And suddenly you change the mechanisms. So, elongate the exhalation, add humming to it, sound to it, get your head below the heart in different postures based on the capacity. Yoga therapy is personalized. What that person can do, you give them. You don't say, look at that image. Of course, in yoga hall, we have to put some image because Maharaji Desai National Institute and Ayush will give some image. Don't think you have to do asana like that. You have to do the asana to your capacity. You have to do the pranayama to your capacity. Again, with the cardiac cycle, the same thing. I always remind people, the heart is only supplying itself during diastole. In systole, the heart is supplying the whole body. But it is only in diastole, it is supplying the coronary arteries. We forget this. So what is happening? If your heart is going faster, we know that 0.8 seconds, what will happen? It will start to become less. So I always tell people, even people who don't know medicine, I go and tell them about this. I say, very simple. 60 per 60 seconds is 1 second for cardiac cycle. Now, if you have 120, it has become 0.5. Normally, we talk of 75. 60 divided by 75 is 0.8 for cardiac cycle. Is how we normally, we go through this. Normally, this is our first year MBBS ka diagram that everybody has to learn and manapada 25 and tell in the exam and tell in the viva. I always remind people, the systole part, that 0.3 seconds, is not going to change much. When the heart goes faster, what is the compromise being made? The compromise is made more on the diastole than the systole. So your diastole is getting compromised. If your diastole period is getting compromised, what is happening? Your coronary perfusion is getting compromised. And this is why when you elongate the exhalation, when you start to do head below the heart postures, you slow down the heart rate. The more you slow down the heart rate, the more you are going to have diastole. The more you have diastole, the better the coronary perfusion. The better the coronary perfusion, the longer that heart is going to keep beating for you. These are the mechanisms. Now I challenge you to show me one website on the net that talks about this. This is the problem. We are not talking this language. The modern medical understanding of yoga is not being talked at all. We have our yoga people who say, I will cure anything. That is also stupid. You have the other side who says yoga is total hocus pocus. That is also stupid. In between, I am stuck. I am a very, very proud member of IMA also and of IYA also. Medical Association member and also Yoga Association member, and in between both sides are saying, what is your other side doing? I said, I am a human bridge trying to bring them together. And that is why, do less and help more. You reset the vagal reflex, You prolong the exhalation phase, the sound to enhance the endogenous nitric oxide level, enhance the diastole phase, so improve myocardial perfusion, and enhance tissue perfusion throughout the body that facilitates healing. These are the mechanisms by which it is happening. And that is why I always focus on pranayama. Because pranayama can be done by anybody. In our hospital, post-op, second day we go into the ICU and we teach them some pranayama. We give them music therapy. In ICU we give music therapy. In NICU also we give music therapy. Neonatal intensive care also we have shown studies in music therapy, how it works. I told you labor also we do. And what are we doing? Pranayamas to enhance sinus arrhythmia, reduce the heart rate BP and RPP. I don't know whether Dr. Ananda will talk about it today, but this is one of Madan Mohan Sir's favorite. Rate pressure product. And I suggest that everybody should take this into consideration. It is a very simple derived index of cardiovascular myocardial oxygen demand. What you have to do is you take heart rate, multiply it by systolic and divide it by 100. Simple. Rate pressure product. I think it was Gobel who did the first study. But if you go and you Google rate pressure product, Madan Mohan Sir paper, my paper will be most. It is a direct indicator of myocardial oxygen demand, because what are you multiplying? Heart rate, number of times your heart is beating, and systolic, the work done by the heart. So the amount of work done which is systolic multiplied by heart rate, you have the work done, the load on the heart. Now this will always go down when you do yoga practices. People who have hypertension, this is going to be high. When you do yoga, it goes down. And we have done a work, Prakash did it at Jipmer, when he was doing in the Autonomic lab. We did a comparative analysis with HRV and RPP. And what we found is there is a statistically significant correlation between RPP going down and HRV going up, HRV power. So if you don't have HRV equipment and you want to know cardiac autonomic function, you just look at heart rate, systolic pressure, and it gives you an indirect index of the work done by the heart and the myocardial oxygen demand. Straight away we can do it. And reducing the load on the heart, enhanced coronary perfusion, and natural collaterals. I have had patients who had blocks, and through chanting, we forget that chanting is also part of yoga therapy. Where doing the chanting, this patient came to me, he is a very big businessman in Pondicherry. His son is a doctor in the UK. And he said, I said, can you do yoga? He said, I don't have time, sir. All my business takes up my time. I said, what do you do in the morning? He said, I get up and for 45 minutes I worship Shiva. Shiva Puja Panva. Sir, onnum prachanilla sir. And the Shiva Puja, that 45 minutes, constantly I want you to be breathing in. And when you breathe out, I want you to say, Om Namah Shivaya. I want you to chant that Om Namah Shivaya, which you are chanting in your Shiva Puja, but without break. What have I done? I made him extend exhalation. He cannot find other time, but during the puja time he can do. And a couple of months later, they did a scan and he had new collaterals had formed, natural collaterals had formed. His son phones me, his son's name is also Anand, he's in the UK. He phones, he says, what is this that has happened, doctor? How can you explain? I said, this is what happens when you start to reduce. When you start to reduce the heart rate, when you start to enhance tissue perfusion, your body has the intelligence to find a way to help you. But we don't give the body time. We don't give the body time. This is the biggest issue. So these are the type of practices. We do the left nostril breathing. Sukha pranayama is just to breathe in and breathe out equally. Savitri is a study that was done by Madan Mohan Sir and my father in 1980 in Jipmer. One of the first papers of yoga from Jipmer was Savitri Pranayama and Shavasana by Dr. Thomve, Dr. Madan Mohan and Swami Geetananda. I think maybe one of them, Balachandra Sir, was also there, who became HOD of cardiology. and Savitri, and then Pranava, which is the A-U-Ma combination that we do. And all of these, normalizing the autonomic cardiovascular rhythm, enhancing cardiac autonomic regulation, valvoreflex sensitivity, relaxation response, decreased after load. You can decrease preload also, you can decrease after load, we can see. And a mild Valsalva like effect here when you are doing Pranava, because it is the sound being made against the closed. It is like a mild Valsalva. It's not the same as Valsalva, but you can imagine the impact that comes over a period of time. And again we have shown this to happen. So practices like Shavasana with Savitri, part by part relaxation, Spanda Nishpanda, what we do is we tense. Part by part you tense the whole body and then you let go. We call it instant relaxation. It's a beautiful way to induce the relaxation response instantaneously. Then Kaya Kriya, which is movements with the breath, and Yoga Nidra, which is a very deep practice that takes you into a state of what is equivalent to stage 4 sleep. Stage 4 sleep, but imagine getting the benefit of stage 4 sleep without sleeping. That is actually the goal of Yoga Nidra. It's been documented, huge amount of studies are there. Reduce the peripheral resistance, enhance tissue perfusion, facilitate healing. And yes,
talked about Yoga Nidras.
Yes.
I have read some literature in some holistic journals that
Yes.
Yoga Nidra is actually more powerful than the normal sleep. What is the difference between both?
Here what happens is often many people like to say Yoga Nidra replaces sleep, but nothing can replace sleep. Only sleep can replace sleep. But what they find is 20 minutes of Yoga Nidra gives you the same benefit of 4 hours of deep sleep. So what they say for people who are sleep deprived and they need to get help, Yoga Nidra can give you the benefit. But we should always remember, Yoga Nidra doesn't replace sleep. Sleep is essential for normal human psychophysiological function. But that is the normal studies. 20 minutes of Yoga Nidra, because what is 20 minutes of Yoga Nidra? Stage 4 sleep. In your normal 4 to 8 hours of sleep, how much of deep sleep do you get? Same 20 to 30 minutes. You are getting that? That is the logic is that. But I would never tell people don't sleep and only do Yoga Nidra. I think that we should be careful. Sleep is best. People ask me, Dr. Ananda, do you have 48 hours in a day? You do so much. I say I don't have 48 hours, but I sleep a lot. And if you sleep, you will function well. Never ever, I tell my daughter, whenever she has a test in Pondicherry University, she's doing MSc Applied Psychology, every test she wants to stay up the whole night. I say, if you stay up the whole night, you will remember nothing. Sleep gives you consolidation of memory. Study in the day, have a good night's sleep, tomorrow your test will go well. But it's difficult. It's easy to talk when you are a parent. When we were children, we didn't listen to our parents, so why will our kids listen to us? Same thing, Okay. We now are moving from biological, biomedical model to biopsychological model, biopsychosocial model. Now it has a spiritual and cultural model also. Now this is a model which always has been in Indian culture. Already it was there. Now we are saying, oh my God, we had the treasure. My father used to say, don't sell your golden heritage for the plastic of the Western world. Today we have realized it. Today we have Indian knowledge system is being promulgated by the whole national education policy, new education policy on biological, sufficient sleep, exercise, life satisfaction, efficacy, socio-environmental, then work and cultural and spiritual, perceived meaningness, mindfulness, general spirituality. Now please understand, spirituality and religion are not the same. Spirituality and religion are not the same. Spirituality is your relationship with yourself. That's all. Religion can facilitate it. Spirituality is when you have a relationship with yourself. And when you understand your role is the cosmos. அண்டத்தில் உள்ளதே பிண்டம், பிண்டத்தில் உள்ளதே அண்டம், அண்டமும் பிண்டமும் ஒன்றே அறிந்து தான் பார்க்கும் போது. Sattamani Siddha has said that. Andam and pindam, the cosmos and we are one. When you realize it. Andamum pindamum ஒன்றே அறிந்து தான் பார்க்கும் போது. இல்லைன்னா தெரியாது. நம்ம என்ன நினைப்போம், நீ வேற நான் வேறு, மதம் வேறு, இனம் வேறு, மொழி வேறு, நிறம் வேறு. What stupidity. We are always looking at divisiveness. We are forgetting the oneness. That oneness is what spirituality is. When you can see somebody and say, you also should grow, I should also grow. We should grow together. Moving from I to we. Which is why it is popular nowadays to say, when the I is replaced by the we, even illness becomes wellness. And that is why stress goes into this nervous system, endocrine and immune, retards healing. Now yoga works on the same mechanism. This is the beauty. Yoga and stress utilize the same pathway, the same classroom, the same elevator, the same stairs are used by stress also, by yoga also. But one is giving you a positive outlook, one is giving you a negative outlook. So the choice of how it is going, I'm going all the way back to where I started. Nothing can stress you unless you let it stress you. You are the master of your destiny. And where does that mastery come? In the present moment. It doesn't happen yesterday. What is yesterday? It is the past. What is the past? It is a bundle of memories. Nothing else. The past is a bundle of memories. What is the future? It is a collection of expectations. What is the only reality as a human being? The present moment. The past is also not real. The future is also not real. Because the past is just a collection of memories, nothing else. And the future is just this anticipation. The only place where you can change your destiny. People ask, is it free will or is it destiny? It is both. Yesterday's free will is today's destiny. Today's free will becomes tomorrow's destiny. In the present moment, you have the power of choice. And I repeat that. The power of choice is the power, the superpower of being human. Only human beings have the power of choice. I can choose my attitude. Viktor Frankl, he survived the Nazi Holocaust. He created logotherapy. He said the last and final freedom we have as a human being, the last and final freedom we have as a human being is to choose our attitude towards whatever happens to us. Imagine the suffering. And that is the same Holocaust study that Antonovsky did. He found the women who had gone through the Nazi Holocaust. They were survivors of the concentration camp. He found that 55% of the women who had been through the Holocaust had depression. Now normal research, what do? We write a paper, publish in Scopus Indexed. What do we publish? 55% of the women who went through Holocaust have depression. Antonovsky was different. He said, why 45% did not have depression? நம்ம அந்த கேள்வி கேட்கோமா நம்ம ரிசர்ச்ல? P value வந்ததா? Sorry to say, modern research is P value oriented. I'm telling people, move from randomized control into individual case studies over a long period of time. Take one patient, your methodology of treatment over 3 years, 5 years, see what happens to that person. That is the best efficacy. But we are still stuck with randomized control trial, which is fine for drugs, not for things like yoga. We are pushing yoga into a model that doesn't work. But anyway, he said, why do 45% of the women not have depression? He started to inquire and he found it was their attitude towards life. Your attitude towards life determines the outcome irrespective of the stressor. So it is not the stressor. It is how you have perceived that stressor, and our perception is different. One person says the glass is half empty, another says the glass is half full, and then one person says the glass is always full. Because it has half filled with water, half filled with air. And then another person says, well, the whole universe is full. That's a different Vedantic perspective. And that is why we need to focus on wholesomeness. Again and again I tell the patients who come to us, I say, the moment the patient comes and I say, Vanakkam, who are you? The first thing, sir, I am a diabetic. I am a hypertensive. I am a cancer patient. They don't even tell me the name. I say, at least start with your name, please. First is the identification with the disease. I am diabetic, I am hypertensive, I am cancer patient, I am. Aduthathu, second one, sir, my diabetes, sir. My hypertension, sir. இவன் சொல்லும் போது தானே சிரிப்பு வருது. நம்ம எல்லாம் இப்படிதான் நம்ம சொல்லுவோம். என் diabetes, my diabetes is better than your diabetes. என்னமோ காம்படிஷன் நடக்குது இந்த காலத்துல. What is your blood sugar? You are only 160, I am 180. அதுவும் அதிகமா இருந்தா என்னமோ பெருமையா நினைச்சுக்கணும். We have to stop identifying with the disease. The first thing is to say it is the disease. I am a human being who has diabetes. Diabetes is not my identity. Because if diabetes becomes your identity, you will never want to change your identity. People are scared. What if my diabetes goes away? Who will I be? நான் யார் எனக்கு தெரியாது. ரமணர் அப்படியே சொன்னார், நான் யார் diabetic patient. So if diabetes is cured, I don't know who I am. I have identity crisis. See, it is a very deep level of understanding of disease today. Until and unless I say disease is an unwelcome visitor, தேவையில்லாத ஒரு விருந்தாளி. இந்த சொந்தக்கார் வந்து நிப்பாங்க தெரியுமா? அந்த இது சொந்தக்கார் ஏன்டா வைக்கிறீங்க சொந்தக்கார்? அதுதான் ஆக்சுவலா we want the சொந்தக்கார், பட் உணவு பார்த்தா போச்சு இந்த சனி ஞாயிற்றுக்கிழமை. You have an unwelcome visitor. That is the disease. Now, if the unwelcome visitor comes, please get them out of your house at the earliest. What do? எல்லாத்தையும் தூக்கி தலையில போட்டுட்டு கஷ்டப்பட்டுட்டு கம்ப்ளைண்ட் பண்ணுவோம். Another last thing before we end here. Stress, negativity is like a dirty creature. Now you are at home. You have a very nice clean house, you have a nice sofa, nice rug, nice curtains, எல்லாமே நல்லா இருக்கு வீடு. உள்ள தெருவில் இருந்து நல்லா அங்கே சாக்கடையில் உருண்டு புரண்டு ஒரு நல்ல சொறி பிடிச்ச நாய் உள்ள வந்ததுன்னா, வாப்பா உள்ள வா, என் பெட்ல போடு சொல்லுவீங்களா இல்லையா? எஸ் ஆர் நோ? அங்கே பண்ணுவீங்க தானே? நம்ம என்ன பண்ணுவோம், இந்த நெகட்டிவ் தாட் இருக்கு பாத்தீங்களா, அது உள்ள வந்த உடனே we don't do that. We say what is next. இந்த சீரியல் பார்த்து இந்த நெகட்டிவ் தாட் வந்த உடனே இந்த நெகட்டிவ் தாட் வந்து அடுத்தது என்ன வரும்? அடிக்கடி ஒரு உதாரணம் சொல்லணும். பைக்ல ஓட்டிட்டு போகும்போது ஐ கெட் தமிழ் மேக்ஸிமம் எல்லாருக்கும் தெரியுமா? சரி, கொஞ்சம் நான் டிரான்ஸ்லேட் பண்ணி தங்கிலீஷ்லேயே பேசுகிறேன். தங்கிலீஷ். I am riding my scooter or my cycle. I go cycling every day. I enjoy my cycling. It's a very beautiful, very good way to, make sure you get those 150 minutes per week. Yoga doesn't give you 150 minutes of that per week. You need something else. Yoga will give you a lot of things. Yoga doesn't replace exercise. Yoga is different, exercise is different. When you try to put yoga as an exercise, it will never go beyond mild to moderate. Even beyond moderate is tough. Your heart rate will never go up. Now, check பண்ணி பார்த்துட்டு சைக்கிளிங் நான் 20 நிமிஷம் போயிட்டு வந்தேன், செமத்தியா ஏறும். யோகா 30 நிமிஷம் பண்ணாலும் ஏறாது, கம்மியாகும். ஏன்னா that is the problem here. So you need that. I am cycling now. My mind will start. மைண்ட் என்பது விஷம பிடிச்சது. இது வந்து குரங்கு. They say mind is like a monkey, a drunken monkey bitten, stung by a scorpion on a hot tin roof in Indian summer. That is your mind. So mind will say, what if I have an accident? And easier ஓட்டலாம். ஈஸியாக உங்களுக்கு தெரியும். From Kalapet to Kottakuppam is maximum accident zone where I am cycling every day. First thought, what if I have an accident? Now, if I don't stop that thought at that point, what will happen next? What type of accident will I have? Will a cow come in the road? Easier full of cows. Will a dog come? Will a human being? Dog, cow, I will tell you with my experience, are very good because அது இப்படி போச்சுன்னா நேரா போயிட்டே இருக்காங்க. The human being, biped. அவங்க வந்து the Greek philosophers said we are featherless biped. We are featherless biped. அதாவது chicken basically. இப்படி வந்துட்டே இருப்பாங்க, பார்ப்பாங்க, போவாங்க, இப்படி போவாங்க. ஏதாவது ஒரு பக்கம் போய் தொலைங்கப்பா, பண்ண மாட்டாங்க. அந்த நாயை வந்து ஒழுங்கா அதை மட்டும் போயிட்டு இருக்கும், இந்த மாடு அதை மட்டும் போயிட்டு இருக்கும். அந்த கவு இப்படி போச்சுன்னா நான் மட்டும் இப்படி போயிட்டான்னு கேட்டாரு. மனுஷன் இப்படி போகிறதா அப்படி போகிறதா பிரேக்கை போட்டு நடுவில் இப்படி நிற்க வேண்டியதா, ஏதாவது ஒரு பக்கம் போய் தொலை. What happens? You are thinking, what type of accident will I have? If I have an accident, will I fall on this side or will I fall on that side? If I fall on that side, will a car come and run over me or will it be a scooter or a bus? If I have been run over, which hospital will they take me to? And the hospital, Ranampa, Setala. Hospital admit pannanga nammala yaar paaka varuvanga? That person will come. This person will be happy. They will not come. Sandoshama party vechi kondaduvaanga namukku accident aayi pochu. Enna pannitena? A simple thought. What if I have an accident is a normal thought when you are on the road. I have built up one full story. And then what happens? The universe says, oh, idu unakku romba pudikkum pola irukke. Tadastu. Have an up. So what do? I practice what I call stop technique. Pratipaksha Bhavanam in yoga, it is cognitive CBT in psychology. Is adopt the opposite attitude. Now it is very difficult when you don't like somebody to try to think good thoughts about them is very difficult. But at least you can say stop. So the moment I am riding, when I get this thought, I say stop. And very strongly I say stop. I don't want to think about that. And immediately what happens? I stop. It is like that dirty wild animal. I have stopped at the gate. I have not let it come into my house. And this you have to start doing whenever people are irritating you. People will irritate you. That is why they exist. People will insult you. That is why they exist. That is why are relationships there? Relationships are there to rub you until you become smooth. Don't expect there will be a relationship that doesn't rub you. It's not possible. All the stones in the river, they become beautiful pebbles. How? Because rubbing on each other. That friction is what will cause it. Sir, 10 பொருத்தம் sir. ஆனா பாருங்க sir. 10 பொருத்தம் என்பது என்னன்னா, not so that you will have a happy life. It means that both of you will make sure all your karma is burnt out in this lifetime. That is the meaning of it. You will burn out all your karma if 10 பொருத்தம் is there. But we are always thinking it should be pleasant. It should be good. Nachiketa is told in Kathopanishad by Yama Dharmaraja. He says, do not mistake the pleasant to be good. Do not mistake the pleasant to be good. But what I tell people, the good doesn't have to be unpleasant. The good doesn't have to be unpleasant. People think just because it's unpleasant, it is good. No, not necessary. It is like they say, geniuses are most often misunderstood. But remember, just because you're misunderstood, it doesn't mean you're a genius. You may be an idiot also. So, I'm going to close here. We need to focus on the wholesomeness. Who is that person who comes to us? It is the whole person approach, not just a systematic approach. When my father was in Apollo Hospital, the last few days of his life, I was doing my MBBS in Nagpur University. I came down, I went to the ICU in Apollo. The kidney specialist came and said kidneys are okay. Heart specialist said heart is okay. The neurologist said the brain is okay. And my father was not okay. Nobody was looking at the whole person. Everybody was looking at their system. Yeah, department and a father That was the day I said I will not become a specialist. I said I don't want to go into compartmentalization. I want to always remember the whole person who's in front of me, which has been my life mission. Look at the wholesome picture. Look at how everything is related. Let us move from dukkha. Dukkha means suffering. We want to move towards sukha. And that is why the International Association of Yoga Therapists, they say yoga therapy is a professional application of principles and practices. The principles of yoga are what I am talking about today. Not just the practices. Yoga is not just asana therapy. And you want to promote health and well-being within a therapeutic relationship. Personalized assessment. Look at that individual, who they are, what they can do, what do they need. Set the goals. What does the patient want? What do you want? What is immediate? What is intermediate? What is long-term goal? And lifestyle management and the practices for individuals or small groups. This is the approach being taken across the planet, and My dear Nilachal, who's here, has made this very nice Ananda. He likes to make this using AI. So the first part is develop awareness. Second is nourishing through a heart-friendly diet, cultivating positive attitudes and mindfulness, nurturing relationships. Discipline is very important. Self-discipline is very important, and acceptance. Because unless you develop acceptance, you cannot have change. As long as you are in denial, there can never be change. Change will only come when acceptance is there. So you have the ANDA Ananda there. And this is my small team, a 12-member team, where we have Shobana, who's also a physiologist, who is heading the music therapy, Dr. Meena, heading yoga therapy, and our team of yoga therapists, music therapists at ISCM. And I hope that you will all get a chance to come and visit us. We are open every day, and you are most welcome to visit us. We look forward to having collaborative work with your institution and with your department, because nobody can do anything alone. Together, everyone achieves more. TEAM. Together, everyone achieves more. So let us grow together and let us bring about a change, a revolution, a change in paradigm from what did I do today for disease to what did I do today for health. Let us bring the health back into healthcare. Thank you so much.
Thank you, sir, for your in-depth presentation. Now I request Dr. Niramati ma'am